This session really is focused on kind of identifying in Los Animas County, Huerfano County, what are some of the current challenges that our folks in the community services are seeing for dealing with OUD, but also kind of the opportunity for regional collaboration. So I'm going to start on the end with Ms. Betsy Johnson. We can get a hi or stand up, thank you. Our interim chief of police, Mike Tohanovich. Ms. Marcy Key with Keep Trinidad Safe. Ms. Jamie Tupper with Division of Youth and Family Services at DHS. Mr. Marty Moloff with our probation office in the 3rd Judicial District. Mr. Rob Archuleta, who's with Crossroads, again, thank you, sir. And Ms. Melissa Field-Algeier, who's our Director of Trinidad Housing Authority.
All right, so we really want to thank everyone for participating in the panel. And we do have some pre-made questions that we're going to be asking folks on the panel to answer. This is really designed for folks to be to hear from different leaders in the community. And, right, these may not be the questions that you all have. So if there's something you're really wanting to know or to hear from folks, please feel free to jump in at any time. So, does anyone want a copy just in case? Or are you guys good with you just chatting?
There's one, I can sit it down. We can pass it back and forth.
All right. So first, we do want to hear, we would love everyone to answer this one, just kick us off. But from your perspective, how has the opioid crisis impacted this community or region over time? We're going to start here and work our way.
I don't know if this is even on. Yeah? Okay. So from a public housing perspective, it's not just the opioid issues, but for us, we are 100% funded only by HUD. So for those community leaders in the room, we don't get state money. We don't get county money. We don't get municipal support. And marijuana is, as we learned earlier today, a gateway drug. But in HUD language, because again, we are HUD funded, marijuana is illegal at the federal level. It is still a Schedule II substance. So on federally owned, federally funded properties, you cannot have it, you cannot grow it, you cannot smoke it, you cannot have it on land or in your unit. And when we find it, I am required, following the laws that I live under, to move to the eviction process. That completely displaces families quite often. And it forces everybody else up here on this panel to have to deal with issues as if they even know them. So it's not just opioids, it's marijuana, it's alcohol. And when I have to clean up a unit or I have to call a contractor to do that, even something as simple as nicotine. You can't smoke in a public housing unit anymore. You can't have it on your land anymore. But somebody other than housing, because you all know this, what do you think it costs us as taxpayers to clean up a unit from simple nicotine use, forget street drugs?
10,000 is what I heard.
It's pretty close to 10. If I have to have a unit cleaned up from methamphetamines, fentanyl, or anything else, take a wild guess.
20,000.
Did I not say housing shouldn't answer? Well, obviously I have staff that have the attention span of a gnat. I don't know all of them, but.
Hey, I didn't hear you, boss.
So it is a minimum of $22,000 per unit. If it is a meth lab, it's more. If it is fentanyl, it is more. So it has to be that has to be part of the conversation, because as funding shrinks, our ability to do what we need to do also shrinks when I have to pay that kind of money to keep things going. So that's how our agency sees this.
So, just speaking on the opioid crisis, right? We're on the second round of an opioid crisis, if you haven't heard. And so, one of the things that happened the first time around was it was the first time that drug addiction made its way across all classes, right? Middle class, disproportionate, economic, nothing mattered. Everybody was hit with the opioid crisis. That's how we ended up in the lawsuits. That's how we ended up with all of this funding. That's how we ended up with all of these opportunities with MAT services. So one thing that happened is, we really did a good job as a society of addressing that, and then fentanyl came into the picture. And now with fentanyl in the picture, what we're seeing is the second round of opioid crisis, but what it really is a polysubstance use crisis. Because even people that their primary drug of choice is methamphetamine, there's fentanyl in their methamphetamine. And so we're just seeing like this level of addiction that is so much different than anything we've seen in the past. And now it's really on everybody's radar because it's not just marginalized communities like it was before. Like I said, I have lived experience and my drug of choice was meth. And so, I always say like, when people go, how'd you go from this? I always say like, looking at it now that I'm, have a doctorate, now that I'm a PhD, I look at it like, that was field work for me. Right? Like that was like an anthropologist, that was my ethnography work. I did it with indigenous drug users. And so when I look at what was happening when I was in addiction compared to what is happening on the streets now, it is a whole different thing. It's a whole different level of addiction. It's a whole different level of desperation to get that drug and to not withdraw, which is making crime harder, which is making homelessness, more prevalent. So I guess what I would say is what we've seen like a reinvention of addiction that is just everything. It's spiritual, it's social, it's physical. It's not just a compulsive behavior. And now, because people are so in depth, like they're so into it, like, and I just want to say this, when you see somebody out there, it's not just about the fear of withdrawals. There's also something that doesn't really get addressed, and I'll shut it down after this. There's something called anhedonia, which is a state of pleasurelessness you feel when you get sober, because your brain's not making serotonin and dopamine. And so like when you have anhedonia, you have an inability to feel pleasure because you're not feeling so even if you get past the physical withdrawals, you have this inability to create serotonin and dopamine, which makes you feel flat, which makes you go back to addiction. Because if you're not gonna be a happy, sober person, you're gonna go back to using. And I just wanna say this, and I say this all the time, nobody gets addicted to things that suck. Right? Like, I don't struggle with chocolate cake because it tastes bad. Right? Like, so there is this feeling of euphoria when you use those drugs and alcohol now, because it's such polysubstance use. We're seeing people not feel normal for months, even a year. And so we really have to wrap our arms around those people. But I think what the opioid crisis has done to all communities, even from rural to the big cities, is it's just impacted every socioeconomic group. If there is take no prisoners.
Yeah, and I'll piggyback off that a little bit. Most of our clients that are struggling with opiates, they're not just testing positive for opiates, they're testing positive for a lot of stuff. And so for us, we spent over $300,000 last year on getting these clients the help they need, whether it's treatment or they're homeless or whatever it is. And so it's had a huge impact on us. And we all know that, like we were talking about earlier, a lot of crimes, even though they may not appear drug or alcohol motivated on the surface, they are, if you really look at it. And so that's a huge thing as far as judicial goes. Personally, I grew up here. And so to see the impact that it's had on our community, breaking up families, that's heartbreaking to see that. And so it has an impact across the whole community, medical field, all this kind of stuff. And so I fear that we have good resources in place, but we need more and more and more, and I just don't know where it stops. I do think that a major thing that we could focus on, it's came up, is prevention. Keeping families together and educating these families and kids early on to not let them start in the first place, because after a while you have a huge mess where there's no one answer that works for everybody. So that's my 2 cents.
All right, so from a child welfare perspective, I really feel like the impact of opiates is kind of ramped up over the last 5-ish years. I've been in child welfare since 2006, and we would have a drug affected baby, maybe once a year, maybe twice a year. And like Michael said earlier, we have 7 babies since I came into my position in Los Angeles County that we've taken custody of. And that's not for lack of efforts, that's not for lack of trying, not for lack of safety planning. We have an interesting phenomenon right now where moms are just abandoning their babies at the hospital, and we are not seeing them again. Of those 7 babies that we have in custody right now, none of them are likely to be returned home. Their moms are not coming to see them. We can't get them engaged, we can't get them to court, we can't get them to services. And it's really sad and it's really frustrating for us as a department to see that. Also, once families lose their housing, they get criminally involved, and they come to us and we remove their kids, they lose that last thread of functioning that they had, that one last anchor, and then they just are gone. And it's really hard to get them back. Like one mom we had would just go walking into the woods when she was done with her visits. And she's one that we have no hope of getting her housing because she's been evicted. She doesn't have any job skills. She's got a criminal record. Like, those are things that are really hard to overcome, especially in a small town. So we as the department can throw all of the resources that we have in efforts and safety plans, but sometimes that hill is just so hard to climb, and I don't know what the answer is, but like the infrastructure just isn't there to support recovery and to help us keep families together and get families back together.
I would say from, like Marty said, prevention. We are finding that prevention has to start in kindergarten, or I encourage you to get involved with the Huerfano Los Animas Early Childhood Council. From 0 is where prevention has got to start. So we're giving small substance use information to our littles. And that's sucks that we have to do that. But so we've had a long history of favorable attitudes towards substances. And parents are doing it with their kids and stuff. And so prevention is huge. As Kim is constantly having to add programs that we do with the health department, I mean, it's a public health crisis. We're having to step in and pick up more, and like you've all said, the budgets are getting smaller, but we're doing more. So every aspect.
From my perspective, I've been in law enforcement since 2008 in this community. I've been here for 16 years. In those 16 years, I came in 2008 at the tail end of that first crisis, the prescription drugs. It was still out there, but it was still prevalent in our community. And then it switched to heroin, and then now the fentanyl. The core component in a lot of our crimes in our community is drug related. That's the honest to God's truth. I would say 80% or more of the crimes being committed in our community have some kind of drug motivation behind them, or something involved with the drugs. It's not necessarily a drug charge. People are losing their jobs because they're addicted and they can't maintain a job. Therefore, they're becoming homeless. Therefore, they need to steal to get their food. They need to steal to sell stuff to get their drugs. So it's huge. It goes beyond what most people actually see of what's going on with crime in our community. And again, we need more resources for recovery and to help get these people the help they need.
So from the standpoint of being medical in the jail, seeing people come in, highly intoxicated, one of the major things that we've noticed is that there's an increased amount of people that we have coming in that are addicted, that are withdrawing excessively worse than usual. But we have more crimes happening, more overdoses, more deaths. We have more overdoses happening in the facility because we're trying to bring it in with them so they're not withdrawing in jail. On top of that,
There's the personal property damage, public damage, even taking my kids out into public to parks. You have the traumatic visual for those small kids that are seeing, you know, somebody shooting up or finding, you know, needles and stuff on the playground and not even, you know, not knowing what it is and going to try to touch it and being after, you know, what are they getting on them or possibly injected with. It's just become a whole family from me being a kid growing up here, where you could walk down the street, go to a playground by yourself and not have to worry about any issues. And now I can't do that with my kids. I have to double check playgrounds and even school, make sure that, you know, there's nothing left there or there's not somebody there that possibly overdosed and they're gonna see it. It's a continued problem. It's just getting worse as we go on. But we run into the issue if we can get them help when they're in facilities like being in jail or rehab. But the minute they get out, there's no follow through, or they struggle to find the resources because the resources isn't here that they want, or they don't have transportation to get to another town to get to the specific medication or whatever it is that they may need for that addiction. So they're just reverting to the easiest process, which is going back out and finding a new fix and getting high all over again. And then they end up back in custody for something again. Thank you all for sharing your experience and your, not just your experience, but your expertise and what you've been seeing across these sectors. It can sound really heavy, really daunting, right? Like that was a lot. I'm curious if anyone can share, what do you think the community is doing well in terms of responding to the opioid crisis? Are there any specific services or programs that stand out to you that the community is doing well to support folks?
This summit was a great step forward.
She's not a plant. People like Marcy and Keep Trinidad Safe, they have peer support groups. They have resources, whether it be in town or out of town, for rehab facilities or counseling, things like that. Crossroads even for detox. Places like that are providing a safe space for everybody to be able to go to, you know, detox to get clean or to get the counseling and help that they need and support that they need. Those are great things, but I just need to be more of the community.
What Melissa said, this is a good starting point. I know this has been around a while, but we need to get more people involved with it. Michael said there wasn't a whole lot of law enforcement presence in the past, and you know it's important for us to be here. We're a pretty key component of this, because we're usually a starting point for these people when they realize they're having a problem, and the police are there. Everybody in this room that has a part in recovery or assistance with families and the people that are going through it, those are the things that are working well, and we need to keep doing it. And don't forget your purpose, because there's other people relying on you. I tell my team that all the time. We talk about mission and purpose. You know, why do we put this uniform on every day? Well, why do you show up to work every day? And why did you volunteer to do what you do? So thank you to the ones that are in this room that are helping.
And I am going to plug Partners for a Drug-Free Community. We meet on the Thursday. Yes, we've changed it a couple times trying to get better, but it's online. Reach out to me, give me your information, and I'll include you in our invite. Marty had talked about our anti-stigma campaign. We're revamping it right now. Help us get it out there. That's a good place to do too. We all get together and try to come up with ways to solve problems in our community. So join us.
So if I can just piggyback off of what Marcy said, she and I were visiting a little bit ago, and in other communities, and I think it's going on in this community as well, but restorative justice matters. And I do think that is a groundwork for our community, is to have restorative justice. It's not just about the sting or the whack from the court system, but it's restorative justice. Part of that is rebuilding that person's accountability for themselves and to themselves, and then self-respect. And most of us, there but for the grace of God go I. It's how we deal with, and I was saying this to somebody earlier, emotion by itself is not positive or negative. It's what we do with it that either makes a success or makes a failure. So I think restorative justice has to be kind of the cornerstone as we move forward as a community, and what does that look like? And one of the things that I have learned is ask the person what they need and coach and support rather than just whack them on the head. So I think, again, restorative justice has to be part of it.
Any services or anything in the community or services y'all think are helping?
So, one thing that I think is great is, I was out of child welfare for a few years and worked in New Mexico. And when I left, we weren't able to get parents into inpatient treatment without them paying for it. And trying to figure out that piece. And now that I've come back and that's changed, I think that is huge. Especially the availability of the residential programs at Crossroads and Pueblo, that is huge. Like that, like I would have killed for that back in the day before I left. But I think another strength is the evidence from all of our programs that we're willing to recognize the problem and be innovative and try to problem solve together, bring in new programs. I know Michael's been really supportive of me trying to change practice in our county, bring in programs like Safe Baby Courts so that we can try and keep families together and, really work to solve the problem.
Yeah, I agree with everything that's been said. I think the partners for drug-free community, the thing, the IOG, the collaboration. I mean, in the rural district, we don't have a choice but to collaborate, so I think that's always been a strength. So I think it's just a matter of expanding that and resource sharing. And we've done a good job of that, but we can always do a little bit better.
I think if I had to say one thing that all the communities, especially in the rural area, are doing, and this is a harsh reality, sometimes it's not about resources. There's a lot of resources in this community. Unfortunately, sometimes people don't want to change yet. They're not there yet. They're not ready to get sober yet. We could open up 70 methadone clinics and somebody might not want methadone. And we have to look at the reality of that. Like, they might not want help. So what these communities and like I said, Trinidad, Walsenburg, Lamar, is the thing that they've done well is they've stayed compassionate, they've stayed dedicated, and they keep the door open. And that's what matters, because sooner or later somebody will want help and they will walk through the door, or they'll end up with Marty and then end up wanting to avoid a consequence. And so what we've done in all the communities, I think, especially in this area, is keep the door open, keep your biases in your back pockets, and just keep working with them and meet them where they are when they are ready, because they will eventually be ready. I look at our detox numbers all the time. We have beds every day, and it's not it's not that they don't need it, they just don't want it yet. But we just keep saying they will eventually want it, and we'll keep the doors open, and we'll just keep the light on, so to speak. So I think the communities, especially Trinidad, just this turnout, is you're staying compassionate, you're staying dedicated, and that's all we could do right now.
All right, thank you. I have a question for Mike. How is local law enforcement balancing public safety with a health-centered approach to opioid use disorder?
Well, that's a good one. We have implemented a co-responder program for behavioral health with the police department. Her name's Althea Lane, and she's been doing great things for us. Because mental health and substance abuse, they kind of come hand in hand.
Can you describe a little bit what a co-responder model is?
The co-responder, so basically it's a mental health clinician that is in the field with my police officers. And we're there just basically for safety support for her. She takes over the call, she takes over the situation until it doesn't become safe for her. And she gets people pointed in the right direction. Whether it's mental health, substance abuse, she'll direct them to KTS sometimes, or any of the other organizations in our area that can get these people some of the help that they're needing. It's not just because they're having a mental health crisis. She'll take in their whole situation in a whole. She'll help them try to get to the DMV to get an ID. She'll take them down to the Social Security office to try to get their their social security checks set up and get them a PO box. She'll help them get through getting birth certificates and things like that. These people lose everything when they're out on the streets. It gets stolen from them, it gets picked up and thrown in the trash, or they just picked up and left where they were, and they don't have those basic necessities we're going to take for granted. She's helping them get on Medicaid and health insurance stuff. So it goes beyond just a mental health situation. And she may not be the one that's setting it up, but she's given them the pamphlets and the phone numbers and the email addresses and the addresses and coordinating rides and stuff for them. So we're just barely getting off the ground with it. We're hoping to expand on that a little bit more.
So recently we put in, the foundation, community foundation, put in a grant for a 3/4 peer support specialist to be with the police department and a 3/4 time to be with the sheriff's office, so that we have a peer support going out with officers too. As I said, 80% of the calls are also drug related, so we thought that would be a good way to help.
And what would you say to people about how that helps the public safety of our community, those types of programs?
Well, first and foremost, it's taking the approach that, you're not going to be arrested for what you're doing, because that's not the right course of action for that particular person maybe in that situation. Before, we didn't have those resources to kind of get these people the help that they need. Not everyone who is addicted to drugs or having a crisis needs to be charged with a crime. Even though they may be in type of a situation where there's a little bit of a crime happening, we want to redirect that and get those people the help that they need. So that's what that's for. And to lessen the use of force on them. They don't want to see the police. Even if you're just having a mental health crisis or you're impaired or intoxicated by a substance, and it's not a criminal related situation, we were the ones getting called to that. And that's typically not what you want to think that the law enforcement officer's jobs are in your community. We're here to prevent crime and take care of crime, not deal with those other situations. We did it because we were the ones that stepped up to the plate and did it. However, we're thinking outside the box and saying, wait, we shouldn't be doing this. This is a mental health clinician needs to deal with somebody that's having a bad day. A peer support person needs to be helping somebody that's having a bad high or a bad day, drank too much, whatever that case may be. They don't want to deal with the police, and we end up getting in a fight with somebody because they don't want to go to detox. They don't want to go to the hospital to get mental health help. These other people are going to talk them into these situations a little bit more tactfully with what they're trained to do. So.
Thank you. Francie, I have a question for you. What are your thoughts on the role of MOUD or MAP treatment in addressing opioid addiction in our community?
So I've seen it work fantastically, but I've also seen people come in and it not work at all. I think it's great, but I think it's also great if it's paired with other options. Support groups, mental health counseling, basically everything else. And in some cases, it's none of that, and it's just a medical situation. Maybe they had an accident and were on pain meds for too long, so they got hooked, and that's what the issue is. So they need to go through a different form of pain management instead of self-medicating. But I think overall it works great, as long as it's paired with other things to get to the reduced shape.
And Marcy, what would you say, take that, sorry, Jeannie. What would you say are the most pressing needs of families affected by OUD?
So I think in our community, we really need our own OMAP program here in town. I mean, it's really hard to access it. It's like impossible. Like I said earlier, I have a mom who goes every day and she leaves at 5 a.m. on her med ride and comes back. Then she doses, she's kind of out of it for a while. But anyways, if we had our own OMAP program, if we had our own sober living program for moms and children, like I said, a lot of times the families that we deal with, they've already lost their housing or they lose their housing in the process, and getting them back on their feet and having that infrastructure available to them so that they have a place to live until they can rent a place or repair their reputation and be employed and all of those kinds of things. Another thing that we need is like how, like, I love the peer support people and I would love to collaborate with you guys because we have a huge problem right now with the families that we're working with and engaging them. And like catching parents on a good day when they're ready to make that change and, you know, helping them, because like we're offering, like, we will take you to detox, we will take you to treatment, just come and get in the car. We will like solve, like help you solve these problems. But like we had a meeting last week and somebody asked me, you know, what else could we possibly do for this mom to get her engaged? And the only thing I could think of is like getting a butterfly net and catching her and like taking her to treatment. So, you know, any ideas that we could get to like help get these parents engaged and, you know, off on their way so they don't need us anymore would be fantastic.
That kind of leads into a question for Rob. Don't worry, I found it. Okay. What barriers do you think clients face in accessing or staying engaged in treatment and recovery services?
Yeah, for some of these smaller communities, it is transportation. Transportation's a barrier, funding's a barrier, IDs could be a barrier. You know, right now we're in a good place. We don't know what everything's gonna look like July 1st, you know, so, but I think the biggest barriers too can also be like in the indirect stigma that's perpetuated by even just a glance, a look, frustration. You know, we know like if you're in the hospital with a loved one and somebody else is in the hospital and they're struggling with addiction, it's also like not everybody that's homeless is dangerous, right? And kind of those looks or this idea of not understanding everybody's story. And so, but you know, I think that there's so many barriers, but there's also like, this is gonna be really unpopular to say, but when you wanna use, there's no barriers. Like there's no barriers. You're like, there's a cop, I'll take side streets for 40 miles and it won't even bother me, right? And so there's no barriers. So like what we have to do is we have to build a community that makes people want recovery just as bad as they want their addiction, because you'll find out that like when you have passion for recovery and you have that self-respect and pride, you will hurdle those barriers. And so it's more than just being about treatment and having services, it's all getting them to understand that it can be better, because that will reduce the barriers. Because you ask about barriers and I can name a million of them: language, transportation, funding, dollars, support, all of it. But if we could get them to have the same mentality, like I always say, chase recovery with the same tenacity that we chased addiction with, then there won't be barriers. Because I would roller skate if I had to in the snow. No, I'm just kidding. So, but I would do that for recovery now. And so it's getting everybody to understand that there's light at the end of the tunnel.
So a question, and we're gonna have you all answer this one now too. But right, challenges and barriers, there's a million. We just kind of talked about that. From each of your own unique perspectives and the roles that you all have, if there were one or two, and you were like, all right, as a community, we're gonna buckle down and focus on these one or two challenges, which ones would they be? And the reason I'm asking this, I'm gonna preface it, right? Like, it's hard to focus on 8 million things at one time. We don't have the money, we don't have the people, we don't have the capacity to spread across everything necessarily. So if there were one or two that we buckled down on, what would you say that should be?
I would say prevention, number one, just because the more of that we do, the less problems we have later on. From a judicial perspective right now, the biggest gap we have is transitional housing. So what happens is we have clients that need to go to residential treatment, and all of that is located out of town. And we have great access to residential treatment through Crossroads and some other providers. But when those people come back to the community, we have, and you guys all know this, we have a lot of intergenerational use, right? Where grandparents, parents, kids are all using. So they go back to the home where the alcohol and drugs was, destroying the the family or whatever. So somewhere for them to come back to transition back to the community rather than going right back to the original residence they left from would be huge for us. That would be the number one thing after prevention. That's a huge gap for probation. That would help us a lot.
So again, going back to, we need our own OMAP program, because I think a lot of the avoidance that we have with the people who are using opiates is the pain. It hurts when you stop using. And that thought of stopping use and coming in and engaging in services and doing the thing and knowing that we're gonna test you and call you on those things, and you know, the fear of, like, we have one mom, every time she contacts me, she says, do I have a warrant now? Do I have a warrant? Because she doesn't want to get arrested, it hurts. And so if we had better access to medication assisted therapies and we could get them on that road to recovery and not hurting so much, and we could get them into inpatient from there, like, I think that is like the hugest thing that we need. And the housing after recovery, like, how do we get them back into the community and functioning after recovery?
I'm gonna say the ugly word of harm reduction, but it encompasses everything from public health to every bit of everything. I like that we're educating everybody on what that is, that it's not just one thing that we're not ready for. It's sunscreen or, you know, all of these things that are lifelong. And another thing is investing in our youth. You know, I've already said prevention, but involving our youth, because we can't plan for them, we need to plan with them. Today we brought one here, and I mean, this has been phenomenal experience for him, and so investing in our youth, that needs to be a huge thing. Because they say for every 3 trusted adults a youth has, they're 70 to 75% less likely to use. So make friends with all those young men.
I'll continue with that, the prevention and starting early education. Getting to these kids to let them know that this is poison, and it's gonna affect you in a very negative light throughout your life. And then the treatment process, you know, the people that we missed and they got into the cycle. Continuing to get them to be engaged with it. That's hard. And I'll tell you right now, from my experience on the streets and talking to people who we deal with that are addicted, and you'll get some of them who will flat out tell you, I don't want to live this life anymore, I want to change. But they cannot get over that hurdle to go get the treatment. Whatever obstacle it is, I mean, we've talked about a lot of obstacles today, but there could be a number of things as to why, or like Rob said, they're not ready to get sober yet. They're not ready to recover. Or they haven't, like the doctor said earlier, they haven't hit rock bottom yet and have that wake up moment of, I gotta do something about my life. So.
I have to again agree, having our own map program with options, because not every solution is gonna work for every single person. That, and then prevention, if we can stop, we're not gonna have, 18-year-olds doing what they saw everybody else in their life do, and ending up in their life of crime, and ending up in prison, still 20 years later going, how did this happen? And I saw the same wrong, no way to fix it. So I would go with that, and prevention is
So just to, so I can't agree more with what everybody said. One of the things I think that has kind of, at least I haven't heard it, is a conversation with all levels of government. Because when there's something that's legal at the state level and something that's illegal at the federal level, it's diametrically opposed. And so where's the communication between states saying to the feds and the feds listening to say, this is not just a Trinidad or a Los Angeles or a Huerfano problem, this is a nationwide problem, and it cuts across every aspect of our communities. So I think that that's one of the things that we need to bring forward as local people, but we need to bring it forward to our state reps, and we need to contact our congressmen and say, we all are part of the problem. Let's instead be part of the solution.
You obviously need an opioid program, that program here. So hopefully we can help out with that somehow. I think if I had a magic wand, that would be my first step for you guys is getting some kind of opioid treatment program here consistently. And then if I had a magic wand that could, we can put people in housing, but if they're not ready for recovery, they're gonna burn out of the housing, they're gonna burn that bridge. Somehow we need to build a recovery community that offers connection, like you've heard the opposite of addiction is connection. Somehow, someplace that builds connection. That's why AA and NA works, because people connect. I like spirituality. There's Celebrate Recovery, which is faith-based recovery, so people connect and have that purpose and that feeling of family and purpose. In Pueblo, we have Addict to Athlete that helps people find, recovery through working out together and sweating together. And when everybody's in sweat clothes, you don't know who's on probation, who's a judge, who's whoever, and so it worked out close. So I think not just the MAP program, but even after they do get back, just as important as housing is a connection and building a recovery community where they can feel normal and share experience, strength, and hope for each other and keep building. And that would keep people in long-term sustained recovery, which eventually, if we do prevention, would start to resolve some of the problems.
All right, thank you guys. I wrote down lots of sticky notes. I'm gonna put it on the garden that no one else is putting sticky notes in, but it's cool. I got your notes in there. Okay, so a question, as community leaders, but also having other community leaders in the room, and some who are not, how can community leaders better engage in raising awareness and promoting prevention efforts related to opioid misuse? So in your community, what do you want to see from your leaders / what can you all do as leaders?
I'll start. More group settings like this, I think, is key. People don't know what they don't know, or they don't get the information that they should be getting. So meetings, seminars, things of that sort.
Education on all of the things. Oh, everybody. Well, that I want to say our youth, of course, they're always first and foremost for me, but there's a lot that people don't understand or know, and I'm also going to go into as community. We need more events for people in recovery. We did the Santa Fe Trail Days last year, and they put us next to the beer garden. That's not conducive to my recovery folks. So we had to move somewhere else, but just being considerate of things like that, so.
So I think Mike is right. We tend to get siloed and, sometimes we get grudges and thoughts about other systems and what they should be doing and they know what we should be doing. So I think, just keeping those walls down and the willingness to work together. And I think, the biggest way that you do the prevention that Marcy and Marty are talking about is also getting parents sober, getting parents functioning, showing their kids, because, I think I've always thought a lot of the problems with truancy and substance use in kids is that you have parents who don't have educations, they don't value educations, they don't pass that on to their kids. Their kids see them using substances. That's often, it's a generational thing that's passed down. And so if we create those sober, like the old school term, the 3-gen approach, we start creating those families that value sobriety and functioning and education. That's a good place to start.
Yeah, I agree with all that, and being involved with this kind of thing to get the word out on, what all these agencies already have in place. I think a lot of the public don't know the resources that they actually have, and also kind of letting out the success stories. I mean, we do have success, and there are people that have came through addiction and go on to live productive lives. So I mean, a lot of times you hear the negative stuff, and obviously that's important, but it's also important to let the public know that we have good programs in place and there are people that have got through this. And so I think that would give a little bit of light to what's already going on.
So I'll give you the bookends, the front of prevention and the end of prevention. So the front end is, we don't need to tell our youth about the dangers of drugs and alcohol. They have Google, Facebook, they could do it faster than you can. And they're probably more accurate 90% of the time, even with anything I say. What we need to do in prevention education is work on self-esteem, communication, critical thinking, and decision-making. Those are the things that keep our teens out of using drugs and alcohol. They don't need to know the dangers of meth. They know. DARE didn't work, and it for sure doesn't work now with the internet. And so just working on those things. Self-esteem is a big one. Communication, critical thinking. I know somebody here does Bonneville Life Skills. Excellent program for prevention education. And then just on the prevention of overdose prevention, is that you? Good job. On overdose prevention, I would say this, just remember every time we give out Narcan, every time we reverse and overdose, what we're doing is giving somebody's mom, dad, loved one, brother, sister, a chance at life. So anytime we prevent death, we give an opportunity for life. So those are the two preventions.
So working with community programs, everybody within the community programs, so it is promoting the treatment, promoting the help. I mean, like we said, it takes them wanting to get the help, but if they don't hear about it and don't know who can help and where to get that help, they're never going to be able to seek it out. So making sure that that's promoted and that's out there, but making sure the community is also educated. What things can they do to help if they see somebody on the street struggling, instead of being judgmental and the whole disgusted looks, then saying things under the breath and walking away. Maybe support that person. Maybe all they need is somebody to say one nice thing to them that day, and it might change their entire outlook. So, but yeah.
All right, one more and then we're, okay. I'm just gonna plug this up real quick. If anybody in this room knows anybody that would be fantastic at teaching about LAC skills, we're trying to expand. Call me.
Good plugs. All right, well, thank you all for sharing your expertise and your knowledge and for being leaders in your community and in this space. I think it's really important to see you all, and hopefully you'll be able to take this information and kind of rally around some other community leaders who may or may not be here. So thank you so much. All right, guys, we're gonna have, oh wait. All right, guys, as we wrap up this awesome marathon of 2 days, I'm going to hand the mic over to one person to lead us out, and then the weekend.
The long weekend.
All right. Okay, so instead of taking a break, we're just going to go ahead and push through so that we can get out of here because everybody's tired and everybody's kind of standing up, everybody's a little restless. So I had the interesting job of wrapping up 2 days of all of this information and leaving us on a high note on a Friday of a holiday weekend and doing it in 10 minutes. So I'm going to do my best. So I wanted to just kind of review the last couple days. So from Lynn, we learned that people are coming up with really creative ways of ingesting, right? We kind of learned that one. We learned that not all tests are the same, but they don't test for, that they didn't have to test for different things. We learned that Rocky Mountain Health Plans is the regional accountable entity, or the RAE for this region. We learned the power of a mirror. And also it works if you work it. Kind of more on a somber, we heard kind of one version yesterday and a version today is you can't enter recovery if you're dead, and dead people don't get sober. We talked about the opioid misuse timeline, that things can get done because of the people in this room, because you know your community. We learned that recovery is like learning to drive, which by the way, I have a 16-year-old that is like 4 hours away from getting her license. So I relate to that one. You can be honest and be kind. Verbal praise is a small thing that makes a large difference. The importance of family supports. The importance of answering your phone. We discussed the risk factors for adolescent substance use as well as the protective factors. We learned about services for pregnant and postpartum women. We heard from probation. And we learned about the 4-to-1 rule. So these are pictures that I took yesterday at our hotel. and I knew I wanted to include these somehow. And it wasn't until this morning, I was really struggling, I was like, Shannon, how do I include these, how do I include these? And Shannon this morning had talked about the flower bed, and, rather than the parking lot. And I was like, oh my gosh, thank you. So we have flowers that are different colors on the same bush. Each of us represent these different flowers. We each have different talents. We all represent different services, but all growing on the same bush. So whether you're a red, whether you're a yellow, whether you're a combination and actually have part red and part yellow. But what was really striking was this one. And this is our peers. You guys know both. And look at how beautiful that is. And there was only one. On all of the bushes that was out there, there was that one flower. You guys truly are a rare breed, a rare gem. But everybody in this room has a place on these flower bushes. Everybody has a place. All of those seeds out there that Shannon has put in our flower bed is going to continue to move this conversation forward. So please don't forget the information that you have learned today. Don't let the momentum stop. Let's keep moving forward and just keep the conversation going. And Shannon and I will be back next year as well for the next one. Shannon's like, yeah, baby. With that, I am going to turn it over to Michael to get us out of here.
Thanks, Jeannie. Folks, I just want to take this brief moment to thank each and every one of you for attending the 2 days. It was a lot of sitting. I feel it. My body feels it, so I appreciate you all. I want to thank our speakers first and foremost, everyone that gave information over the 2 days. It was a lot of information, and I do hope that this is the seed of something that is to continue on year to year and grow bigger and bigger, just like these flowers will in that garden bed. So I'm excited to see what we do next year. So thank you to them for really pointing that colorful idea out for us this time. I just want to give a quick shout out to Trinidad Times TV over here. The presentations were all recorded. I will be sending out an email. I planned to do it last night for day one, but really I want to wait until we get all of the links available. So sometime early next week, I will be sending an email out to all participants. It will include all of the links to each of the sessions. It will include the slide decks available, the handouts. It'll also provide you with a survey link. We ask you to provide feedback on how we did, what can we change, what can we do better, and so we just appreciate that feedback. I also want to give a shout out to the C4 Region 19 Opioid Abatement Council. The alert has arrived. Tell me to get over here, get out of here. Again, Commissioner Felix Lopez for providing DHS with the grant to produce this. And again, I want to just give a huge shout out to Jeannie and Shannon. Where did Shannon go? She disappeared on me. Jeannie and I both agree. However, I really would love to give Shannon a huge shout out because Shannon was really the one who was able to coordinate and bring these experts down to Trinidad today for us and yesterday. She was the connection that we needed to make this a much bigger platform than we thought it was going to be. So I think a round of applause for Shannon. And a shout out and a congratulations to everyone in this room, those that were here, those that are not, but thank you again. Without this conversation happening and moving forward and keeping it going, we can't go anywhere but where we're at. Again, selfish plug, the quarterly meetings, the leadership, again, that'll be August 11th. If you're interested, just shoot me a quick email and I'll be glad to add you to the distribution list. Thank you, everybody, and everybody online, thank you as well. Have a great afternoon, a safe trip home, and a wonderful weekend.